This session is being recorded and will be available on our website. If you have any questions, then please put them in the chat. There will be a link in the chat for any feedback. We would really appreciate your feedback. So today's webinar is on seasonal influenza vaccine for this year, 2021-22. We will be covering eligibility for influenza vaccination,
Again, I've lost Ranjan. Has it everybody else, or can other people hear? Is it just me?
I can't hear you.
We've lost her as well.
We've lost her.
I'm wondering then, Lewis, whether it's worth.
Ranjan?
Yeah.
Ranjan, we lost you
Ranjan,
again, I'm afraid.
We keep on losing you.
My
I think we'll
microphone is
just.
on.
Would it be worth you doing it, Lewis, maybe, if you've got the presentation?
Yeah,
That's the second time we've lost Ranjan.
Let me just. Sorry, Ranjan.
Sorry,
just
yeah.
technical issues. Nope. Sorry, I need to share. Yeah. Right, so can everybody hear me? Yes?
Yeah, that's fine.
Yeah. Okay, so I'll be presenting this webinar. So just to go through eligibility, agenda. So we're going to go through eligibility, flu searches, templates, maximizing update, dashboard and resources. Just a quick word of congratulations to everyone. There were high numbers achieved last year. 80.9% of those aged 65 or over vaccinated. 65.8% of the frontline healthcare workers and 61.7% of cumulative uptake for school-aged children. So this was really great news. And however you've performed in your own particular practices, remember you've all contributed to this success. So carry on with the good work. So going on through to eligibility. So this those aged 50 years and over, where you of course continue to prioritize the over 65s because they're the ones at higher risk. Those in long stay residential care homes, carers, those aged 6 months to under 50 years in clinical risk groups, and all children aged 2 to 15 years but not 16 years old on 31st of August 2021. And then close contacts of any patients who are immunocompromised. And of course, your frontline health and social care staff. If you want more details on this, there's a chapter 19 provided for you once you receive this presentation. So just a quick word on flu vaccinating your staff, supporting advice on administration of the seasonal flu vaccinations for staff. Again, we provided a link for you to find out more on that. And GP practice staff flu vaccinations should be reported onto IMS forms. Make sure you do that. Again, another link of more information. So I'm going to go through the IMS web demo, going through searches and templates, but all practices were on system 1. Remember, the searches and the templates are essentially the same. And so we'll be going through IMS web at the moment. So I'm just going to revert to IMS. Let's go to searches. So if you haven't accessed our searches before, the You can access, if you go to the population reported, in one of these horizontal bars at the bottom, you'll be able to find your locality's clinical effectiveness group. I just happen to be looking at City and Hackney, but it'll be one for your own locality. If you cannot see that, there's a little set of pair of arrows at the bottom here. Click on that, show more buttons, and you'll be able to find this. Once you find this, then you have this the search structure coming up. It'll be different in all your different localities. On the recent CG bulletin that we sent out, every single locality would have received a nice little screenshot showing you exactly where these searches are. So I'm going to start off with so this is the flu searches here, and I'm going to start off with your eligible populations. So first of all, it goes according to risk, so age risk and then at risk. It just happens to be 10 different searches there for all that. So patients age 65 and over, you continue to be your highest risk, excluding care homes and housebound patients. Now there are two separate searches for those patients. So patients living in residential care home, those are obviously going to be seen during vaccinated during the ward rounds. And patients who are housebound, these are meant to be visited by the district nurses. And then we go on to this new population, which is 50 to 64. It was introduced last year. It's continuing this year. We don't know when it might end. It might say a long time. We don't know just yet, but it continues this year. Again, they exclude care homes and housebound patients. So again, look at those two searches I showed you above. And then you start off with looking at clinical risk groups. So 18 to 49, and this excludes pregnant women. Now the reason that's the main reason that they are excluding pregnant women is that because you might need longer discussions with these women. So there's a separate search provided for you so that you can focus on those particular patients and perhaps provide different invitations to cater for their needs. And moving on to then healthy pregnant patients who are also eligible, and patients over 6 months and under 18 at clinical risk. And these ones exclude patients 2 to 15 years old at risk because they're separated out in different searches, and I'll see why. So you have children aged 2 to 3 at clinical risk, and then healthy children 2 to 3. So that's mainly your main responsibility in terms of flu vaccinations. And then you have a set of searches for school children who are mainly the responsibility of the school vaccination program. However, for patients, whether they're in primary school or secondary school at clinical risk, you do have a responsibility of vaccinating these patients if they have been missed from, by the schools from the vaccinations. And then you can also, if you wanted, do healthy primary or secondary school children in an opportunistic way as well. So I'm going to start off with look at the other searches. So for all of you that are inviting and creating all these the vaccination programs, the main search for you to look at is the influenza recall search. So as you can see, these are practically identical to the eligible population. However, the searches, these particular searches exclude any patients who you've vaccinated already. So make sure that after you've gone through a vaccination sessions with patients and you're recalling your patients, that you rerun these searches, otherwise you might end up with patients that you've already invited. If you want to see the detail of that, you can also click on this button up here, full hierarchy, and then you can just quickly see parent population and then those who are for recall, so already excluding those who are vaccinated. Now, moving on to uptake. These searches are just purely for uptake. They just output activity, so all the vaccinations that you've already done. As you can see at that point, this particular locality was already vaccinating some of these patients, but not others. And the main things to look at on this one are your percentages. So keep a check on your percentages so you can check on your targets as well and see whether you're meeting your targets. And as you go throughout the season, obviously that will be increasing, and then you can decide on which particular set of patients you want to focus on. And then we have another set of searches here. These are data quality, in data quality folder, but they do include some information and some data quality. So the first search is flu vaccination coded as a problem. I know it's right at the beginning of the season, so there's nobody in particular has been coded as a problem, but in previous years you always get some flu vaccinations coded as a problem, and you shouldn't have that, so you need to correct those and clear the patient's problem page. So anyway, so that will give you the list of those patients you need to look at. And then there's an information one search here for contraindicated this season. So if you wanted to identify who has been contraindicated, you come to this search and you'll find your patients there. And then we have a flu vaccination coded more than once. As far as we can work out, there's several ways that this can happen. It can be the same person coding a flu vaccination and then inadvertently then going back to the same record and coding again. You can get two different people from the same practice going in and coding the same vaccination. That might be due to clear responsibilities on who's coding, etc. It's an issue with that. And you can also have different codes added. For example, you might have someone adding a midwife code, flu vaccination code, and somebody adding the usual GP vaccination, flu vaccination code. So then you get two more entries in there. So there's a nice little report provided for you there. This one is a line-by-line report, so it will give you the dates and the codes used, and so then you can follow those through and check out which consultations those were done and who did those, and then correct as appropriate. Now, then you have the flu vaccinations decline this season. This one's quite useful, might be more useful towards the end of the season, where you might have a bit more capacity and you might be able to pursue some of these patients and see if they change their mind, so you can persuade them to vaccinate. But it's entirely up to you how you deal with those patients. And then we come to a very important search here, because this is an agreed set of codes for payment, and there's an agreed set of codes for cover. And sometimes the wrong codes are used. So this is alerting you to, in this case, this locality's got 18 patients coded with the wrong code, and so they will not get paid. They will not find it into their cover audits. And so again, there's a good line report in there that identifies all those patients, the dates and the codes that were used. And so then you can go back to the consultation and correct those as appropriate. So now we got a very interesting search here. This is lives with immunocompromised person. As you can see, in this locality, there are 7 patients coded as living with somebody who's immunocompromised. You should all have a set of COVID-19 CAG support searches, and within that, there's a search called Living with Patients with Immunosuppression. And what it does, it provides you with a list of patients who are immunosuppressed patients. So as you can see, there's quite a large number, over 6,000 in this particular locality. And when you compare it with how many patients have been coded with lives with an immunocompromised person, you can start getting an idea that there might be quite a large lack of coding here, and you potentially have quite a large group of patients to still vaccinate. So do have a look through those and make sure that you go through the this search up here that identifies the patients, and then identify who they're living with and code as appropriate. Now, the last search in this set is needs influenza vaccination coded this season. So they've identified 20 already in this locality, and this search is for patients who there's some clinical decision being made that they would benefit from an influenza vaccination. And so you add that code. Once it's on the patient record, then you'll find them in this list, and then you can, if you haven't vaccinated them already, then you can invite them for vaccination. So I'm just going to go through to the template now, just to show you the template quickly. So when you run template, I've got it here, but remember all the CAG templates are prefixed with RP, yeah, resource publisher, or they have in brackets RP. They're easy to find. You'll usually have, you might have it in your recently used list. So I do know that a lot of you already use the F12 key. The F12 key is launches a small protocol that allows you to add all the influenza coding through that protocol, and it closes up a small little template, which you can edit and add the batch number and other information so that you don't have to keep on entering it all the time. However, this template is quite useful because it not only allows you to do the same and enter your vaccination that you just done, but it also provides a set of codes for any other healthcare providers, pharmacists, midwife, or when it's being given while in hospital. So this can be coded through there, so you can enter the vaccination details through there, or visiting healthcare providers. They might want to use it. And then within this, you can also code patients if they've declined, contraindicated, not indicated, or have an allergy. And then, as I was saying earlier, then you got this information here for clinical discretion, for adding a patient who needs influenza immunization. So if you do find a patient that you want to give the flu vaccine to, make sure that you code this, tick that box, and add a rationale of why you deem them suitable to be given the flu vaccination. Now, while you're doing your vaccinations, you will inevitably have some patients who are eligible for a pneumococcal vaccination or a shingles vaccination. So do make sure that you also give those and code them through this template. So I'm just going to go back to the presentation again. As I said before, system one, the searches, they looks practically the same. They are constructed in the same way. There's just differences in the system. That's all. As you can see, the template, the first section of the template is exactly the same, giving you the same information. Right. So dashboards. So CEG produces a weekly dashboards which are based on NHSE uptake ambition targets. We also produce an IIF quarterly dashboard, which is based on 3 IIF targets, and I will speak more about those in a sec. So as you can see, the uptake ambitions for 2021 for patients aged 65 years or older are 85%. Patients aged 6 months to under 65 years in risk groups, they maintain 75% or higher. And then you got 3 pregnant women groups in a risk group, not in a risk group, and then all of them together. But they're all the targets are all the 75%. And then last of all, you have a health and social care workers, and for these ones you have to achieve 100%, but that's 100% offer. So this is an example of the dashboard. Is from last year. The new dashboard is due to come out this week, but they give you information on all the different cohorts that you have, A to F. And then this particular one is giving you the information on all the different localities that we cover. Total eligible population, vaccinated, uptake, decline, and vaccinated. And then here it's quite useful to see how many patients are still required to reach the 75% target. And then you have a breakdown per cohort. This is only showing cohort A, but you get all the different cohorts as you go along the dashboard. And there are also some graphical visuals that allows you to see how you're progressing. This is from last year, so on the 11th of October last year, you have a particular practice. Hello, to have a particular practice that was doing particularly well at that point, and that shows this quite nicely. Also, these dashboards do give you a practice by practice breakdown. So as you can see here, these are PCN by PCN, but what follows further down on the dashboard are all the different practices and what they've done. And it goes by each one of the cohorts, shows you information on each one of the cohorts, and it's got a very useful visual like rack rating or color coded. So you got 100% for aspirations, you got 75% for minimum, and less than 75% indicates off target. So this was at data at a very specific point in time. And you can see no one had achieved at that point. So what about the money? So there is an item of service payment of 10.06 per dose for eligible patients. And as I mentioned before, there's the needs influenza immunization code. If you add that, you'll get paid for that. However, as far as I know, they do not count in your cover, but certainly use those and you get paid for those. And then for the PCN desk, so the IIF Investment and Impact Fund, there are 142 points available at £200 per point. There are 3 flu indicators this year. For those who received a seasonal influenza vaccination, and the eligible populations are patients aged 65 and over, patients aged 18 to 64 and in a clinical at-risk group, and then children aged 2 to 3. So as you can see on each one of these, you got a maximum points. Maximum points are achieved if you achieve the maximum target, and you can see each one of those has got the maximum range, the target range. So we have provided a series of web links that you can have a look at, and quite informative. And so do have a look at those. And I just wanted to also just show that the CEG bulletin is very useful. This is the last one that we sent last week. It was totally focused on flu. And as mentioned earlier, for each locality, you get a nice little screenshot guiding you to where the searches are. And there's also other information. This is just a small part of it, but do have a look through that. And if you do not have the bulletin, have received the bulletin, then we require your details for you to receive it. So do send us your details. And if we already have your details, it might be just a question of setting a flag for you to receive those. So do contact us. So obviously contact your particular facilitator for each one of your localities, and they'll be able to do that for you. And also any queries you have, further queries that you might have after this webinar, you can also contact your facilitators who can help you with the searches, with the templates, and in fact can help you with any of the CEG tools for enhanced services and Apple tools and so forth, even QoF. Okay, so any questions? Is everybody there? Nightmare. I've been talking to nobody.
Lewis, somebody's got hit their hand up. I can't see, but
Okay, so Misal Satish.
oh, sorry.
Trying to unmute them, but it won't let me.
Are you trying to unmute them?
Yeah.
Charlotte might need to do this if she's managing the system.
It's Charlotte's managing. All right, while you're doing that, let's just have a quick look at the.
Satish, have you got your hand up? Can you unmute yourself?
Yeah, I'm muted now. Yeah, I just want to ask, in the website, there's an air bubble. Do we need to remove that?
We can't
cannot
hear you.
catch that. There's a lot of feedback. Hello?
Hello? Hello?
We can just about hear you, but not very clearly.
Let me do the check.
If you turn the volume down on the presenters, yeah, say your question and then turn the volume up.
Can you type the question in?
There's a question that's coming up. So Paula BC says, apart from F12 to add the vaccination, is there any way in the image when we add the code, it will add what vaccine we have in practice without having to keep typing batch numbers, etc. No, that's a problem. Just the F12 key. It's a small protocol that you'd have to add to your F12 key. If you don't have it, I guess we could get it for you. But if you use the templates or add it directly through just code, you will always have to type in all the different information. So that's why people prefer the F12 key. Okay, I can show you. First, I have to find it, and then I can send it to you, and then we can have a separate meeting to go through that, I guess. But that'll be true for any of the facilitators. Anybody that needs a F12 key will have to get it, because I'm not sure who produced it. Might have been one of my colleagues. But yeah, we can definitely access it for you and then send it to you and show you how to use it.
Lewis, we can send screenshots with the slides.
Yeah, but they might not have the actual protocol, so that's what I'm talking about, that we may need to also send the protocol. And if we're sending the protocol, we might as well create some instructions as well.
Yeah, we'll send that over.
All right. So if there are no other questions, if who was it? Mr. Mitchell, wasn't it? If you can type in your questions, either put it in the chat or contact your facilitator, your locality facilitator directly, and they should be able to help you. I'm sorry that we couldn't help, but it was difficult to understand and because of the feedback. I think that's it. I think we'll end there. So if there are no more questions.
The forms, Lewis. Feedback forms.
Sorry. Oh yes, please. If you could all fill in the feedback forms, and we'd really appreciate that, please. The link is in the meeting chat if you haven't looked at it yet. And I think we'll probably send it to all of you anyway, just in case. All right, so I guess codes from pharmacists now coming in direct. Will this all be picked up by templates you create? I'm not sure of that question.
Keith has answered it. Lewis, pharmacy system
Yeah.
should feed directly into EMA's CC bulletin last week.
All right, brilliant. Thank you. Okay, any more queries or should we end here? Okay, thank you very much, everybody, for attending. And we'll be in touch. We'll be sending you the presentation in due course. Oh, and because this meeting has been recorded, we'll put this up on our website so that you can go back and have a look again if you need to. Okay, thank you very much. Bye.